My names are Bentado Omia, and I'm a community health volunteer at CFK Carolina for Kibera. I'm a CHV from Katwekera village. We are 60 CHVs, but we are currently 2 volunteering at the CFK for Kibera. Okay, in 2010, when the Ministry of Health was recruiting CHVs, that was how I came to know about CFK. They were looking for CHVs in partners with the MOH, Ministry of Health. They recruited 60 CHVs, and we were among the lucky ones that were chosen from the community through the community outreach, the Chief Baraza's outreach. To me, CFK means Carolina for Kibera. It is involved in the community of Kibera that consists of the 13 villages that we have around Kibera. So they include the health initiatives that happen around our community. My favorite things when volunteering in CFK is the behavior change that I see happening around my community. The number that was there of ignorance was very high. It tries as much as it can to be inclusive in our behavior change. One particular initiative that I know has taken impact in the community is pregnant women who used to give birth in the house through the traditional birth attendants. Such women, they never saw the importance of going to give birth at the hospital. So when CFK came to the community, they taught us, they gave us a lot of health talks on how to talk to these pregnant women so that they can be able to see the hospital as somewhere, an avenue that they can consult much more than the TBA. So that is why I particularly see that it was good volunteering in that initiative. My biggest achievement, personal, since I started working in CFK, I have grown from the little health that I knew. I can even now expound, because for example in the 12 churches that we have around this area, I'm always called to go and give health talk. So I know I've grown, because people will come to me and ask things to pertaining pregnant women. They collect pregnant women in the churches, they call me to come and teach them. Mothers who are with children under 5, we talk to them, we tell them all things that they should know about health. If they have questions, they ask. If they need referrals, we do referrals. So I know that I cut across Kibera, because our 12 churches are in every village in Kibera. So normally we have health department. So they call me, they say there's a lady in the Rajani SDA church. Go there and you call her, she comes and teach our women. So when I go there, a lot of pregnant women, a lot of young mothers, they tend to ask a lot of questions. Even the men, they are asking, where are they put in these health factors? So sometimes we don't address that issues, but I like to come forward to involve also our men in these issues. We've only concentrated in women, so if we can move ahead and grow in that lane, I think we can be sailing in the same boat. What inspires me are the challenges that I always come across with. For example, people who are living with HIV. When you find defaulters, sometimes it is so hard to talk to them But because we have learned a lot of health talk, you know what you can tell him until he accepts to go back and never become a defaulter again. You give him or her hopes that when you do this or when you take these drugs, you'll help your family and you'll also help the community. So when he understands such things, that he is also important in the community, he'll not be a defaulter. And even he'll call you to ensure that there are no defaulters around him. The last experience, it happened a week ago, was that there was a lady. She was not in our care groups. She was just a neighbor woman who just moved in. We went in a house. We were called with other women that there's a lady who is suffering. She's pregnant, and we've had some noises in her house. Since we can't go to her house, you are allowed to go to her house. So when we ran there, we found the lady had given birth. She had no clothes. She was struggling to pull the child, so we had to pick it from there. We had to do whatever we had to do to ensure that she goes to the hospital. However hard it was, she had no money, she had no clothes, she did not prepare any birth plan. But when we walked in there, help was found. The care group that I have there collected clothes, contributed money. So when we removed her from the hospital, she had clothes and she had food to eat. So that made me stronger.